Hi, Callbox clients. My name is Katie Lawrence, and I am the Director of Consulting for Callbox's healthcare clients specifically. We thought we would take a minute today and just chat with you guys about what we're seeing in the industry during this very difficult and truly uncertain time within the US right now. Due to the ramifications of COVID-19 and the requirement of offices being closed all across the US, practices and our clients specifically are really battling what to do with their current patients, with appointments that they have on their schedules today, and trying to figure out what is the best approach for future appointments. Do we rebook all of our clients right now? Do we work to undo the current appointments that are on the calendar and wait to reschedule all of those? All of these questions are being faced today by our healthcare clients, and I'm sure all of you are familiar with this battle. The most important thing we want you to hear from us is that having a plan in place is one of the best things that you can do. Even if you're not totally confident in what that plan is, moving forward with a plan that's going to inform your patients of what you're doing is really the most important thing. So making that plan and then getting the word out there so that your patients know what to expect from you. We're hearing that many of our offices are closing down completely, meaning they're not seeing any patients for the next 3 weeks. Some offices are just limiting hours. They're able to keep their doors open for emergencies only. Whatever it is that you're doing, whatever your situation is, getting the word out to your patients is really the best way to make sure they're cared for during this time of uncertainty and unknown. So let's talk about what we're seeing today with some clients specifically. Some of our clients have decided to go ahead and start rescheduling the appointments that they're canceling today, meaning they've picked a date in the future. Most are at least a month out, and they're going ahead and putting patients on the calendar for the month of May and beyond if needed. There's risk involved in that, right? Because we don't know what the future holds. But letting those patients know that they are a priority for these practices and making sure that they secure a time on their schedule for the summer is really alleviating some of the stress that the patients are under in this unknown time. The second thing that we're seeing is offices calling their patients to go ahead and just cancel the appointment and saying, when our doors are back open, then we'll call you to rebook your appointment and get you back on the schedule. That plan also is helping to alleviate some of the stress for these patients because now the patient at least knows what to expect. They feel confident that the office is going to get back in touch with them and let them know, as their doors are open, how they can get them back on the schedule. There's one common thread in either of these when it comes to rescheduling these patients, and that's informing the patient of what you're doing. Of course, we know that social media is a great way to do this. Sending out emails is a good way to do this. But it's really the personal contact of an outbound phone call that makes the difference for these patients. You all know, because you're dealing with uncertainty, anxiety, and fear during this time, that hearing from somebody personally on an outbound call, getting to hear the sound of their voice and how much they really care for you goes a long way during this time. So our offices that are using, some of their staff members to make these outbound calls are really getting a positive response from their patients, whether they're able to reschedule them now or the message is simply, hey, we're going to call you when our doors open and reschedule you then. Truly outbound calling is what's going to be the biggest differentiator for offices during this time. I'll tell you, at Callbox, we are banking on you pulling through this uncertain and really unknown time to get through to the other side. We want to be able to help you do that. So if there is an opportunity for us to help you out with specific routing so you can get callers maybe on an inbound call somewhere that they can help, that to someone that can help them, or if it's putting specific messaging on a bridge to inform a patient that your office isn't open today, but you'd be happy to call them back when the office is open and after this is all over. Please, please reach out to us. You can fill out a support form right in your platform, in the Callbox platform, and submit a support request, and one of our agents will get right back in touch with you. You can also call your Callbox consultant directly. You've got their phone numbers if you've been with us for a while, but if you can't find that phone number, we do have a general number you can call, and that's 214-446-7867. That number reaches our support agents, and we are here to help you navigate and get through this time in a way that makes the most sense for your practice and your patients. Our goal is to get you through to the other side of COVID-19 with your doors open and the ability to handle the patient demand that we know is coming on the other side of this. So please reach out to us. Let us know how we can help you. Again, my name is Katie Lorenc, Director of Consulting here at Callbox. And we can't wait to hear from you so that we can help you navigate this further. Talk to you guys soon. Bye.